The jury made robust recommendations today, a total of 9, the majority of which were aimed at Island Health, calling on changes to their Psychiatric Emergency Service Unit known as PES, with the hope of preventing similar deaths from occurring in the future. 43-year-old Paul Spencer died 5 years ago in a seclusion room at Royal Jubilee Hospital following an altercation with security after trying to leave.
And it's so sad, it's really sad. There needs a lot more schooling, teaching, and how to help the security guards in a situation that happened with my son.
Spencer had been brought to the hospital by a Saanich police officer after his mother called police when he left home while suffering from delusions. Spencer was admitted to Royal Jubilee Psychiatric Emergency Services at night when there are no psychiatric doctors scheduled. After waiting several hours, Spencer tried to leave. A security guard stopped him, leading to a struggle. The men fell to the floor and 2 other security guards arrived to help, one issuing punches and kneeing Spencer, who was resisting but not violently. There was a video of this fight. Czech News applied for it to be made public, given that this is a public inquest. The presiding coroner denied that request after Island Health lawyers fought to keep it from being published. Following the altercation, Spencer was placed face down in a bed in a seclusion room, unmonitored for several minutes. When staff came back, Spencer was dead.
They didn't know what they were doing. They didn't realise that when you leave somebody prone for more than 1 minute, all their guts go in their lungs and they can't breathe.
Spencer's official cause of death was the result of a cardiac arrest, most likely caused by a combination of factors, including physical restraint, existing cardiovascular disease from high blood pressure, schizophrenia, and the prolonged use of risperidone for its treatment. Today, the jury made 9 recommendations in relation to Spencer's death. 7 were towards Island Health, among them increasing the number of mental health workers in PES, requiring staff to preserve all evidence after a critical incident, and reviewing the risks to patients in mental health distress after being restrained, suggesting they should be monitored for at least half an hour. They also suggested having CCTV video and audio throughout the ward, that everyone involved in a critical incident be interviewed immediately. The jury also made recommendations to the Minister of Health, calling on the province to bring in an independent investigator for critical incidents resulting in death that happen in BC healthcare. They're also calling for a review of Section 51 of the Evidence Act to ensure public accountability regarding investigations into deaths like Spencer's.
So people can see transparency, what happens.
Spencer's lawyer told Czech News in a statement, the true facts around his death remain completely hidden for almost 5 years until this inquest, and that should be of grave concern to the public. Now, the question is whether Island Health will implement the recommendations. The family says it would be a travesty for our community and an insult to Paul's memory if no action was taken. Today, Island Health's president said they're going to review the recommendations and take appropriate action, something they say will likely build on the work they're already doing to improve training, investigation, processes, and the quality of care at PES.